You have been prescribed a CPAP, but you absolutely hate wearing it. Not many people really do enjoy wearing the machine. Not dealing with your sleep apnea could be hazardous to your health though, but how do you get away from the CPAP and still deal with it? We have the answer, perhaps, this morning in Dr. Anna Smith of Dentistry with TLC, and she is here to help. These things were very helpful when they first came out, and when they were the state of the art, a lot of people, were able to sleep finally and get some relief. But the fact of the matter is, it's obtrusive. It's a little embarrassing for some people. It may not be great for someone that you're sleeping with, for your spouse or whatever. So there's a way around that now. And the cleaning, by the way. We don't talk too much about what a pain it is to clean these things.
Yes, it's almost impossible to keep a CPAP clean because it's just filled with wet air, and wet air traps bacteria, and then you're pushing them down in your lungs every day. And a lot of patients that I see will come in because they have chronic lung issues, or they have eye infections, or they have nasal issues from all the air pressure that's being put in their body and the filth that comes along with that.
Not to mention the claustrophobia that some people get from having a mask on their face when they're trying to sleep.
So the most common complaint is, I cannot sleep with this mask on my face. And who could? It's not normal to have something on your face like that. But this is the alternative. If you can't use a CPAP, if you don't like your CPAP, then this little appliance is a great option. And it's just like wearing retainers. Anybody can wear this. If you've ever worn a sports guard or a night guard, that's what it feels like. But it's specially designed so that your jaw stays forward while you sleep. It doesn't fall back. That keeps your tongue out of your throat so that you're not snoring and you don't stop breathing. So
that's what happens? That's what sleep apnea is falling asleep, and what happens dynamically?
When you fall asleep, your muscles relax and your jaw will fall back. As your jaw falls back, your tongue is connected to your jaw, so your tongue falls back. And when your tongue partially blocks your throat, you snore. When it completely blocks your throat, you stop breathing, and that's the deadly part. If your body doesn't get you to wake up enough to take a breath, you die in your sleep.
Now, I've seen things advertised before that you can buy off the shelf without a prescription or whatever and stick in your mouth, and claiming that they can do the same thing that this appliance does. The problem is, we're all different. We have different jaws, alignment, we have different teeth, and these are custom made.
They are. The problem with those things is that you're doing it yourself and you don't know what you're doing. That's my job. That's why I've had training for this, and I've done it for over 10 years, is I'm going to look at a person and I'm going to make sure that I put their jaw in the correct position so that they don't deal with jaw issues later, so that they can chew and eat their food later, and so that it's actually successful. I have over 95% success with these because I know what I'm doing.
And when you say success means not only curing, I guess we'll say, the sleep apnea, or at least effectively dealing with it and eliminating it, but also keeping people comfortable, so that it's not, if you're thinking, oh, that's going to make me sore, I'm going to feel it there, I won't be able to sleep.
Right. Yeah, whenever you have this in, you should be sleeping really well. When you wake up in the morning, you just take it out and everything goes back to normal. And all the things you mentioned at the beginning, the being embarrassed and not being able to sleep with the mask on your face, that's also success. When those things go away, you finally get a good night's sleep.
And you get away from that. If you're ever out with somebody, if you're hunting with the guys, or the ladies go out for a weekend at the lake or whatever, and you don't want to have to lug that thing around, you can, and it's barely perceptible at all. You wouldn't even know that somebody's wearing it.
You can wear it on an airplane. Nobody knows.
I got one last question. If we call 1-800-JUNK, will they come and take this thing away?
Probably.
Okay, we'll find out, won't we? All right, Dr. Smith will be at the, all right, we rolled right past it. There are some upcoming free community seminars about sleep apnea and oral appliances. Tomorrow at 1:30, head to Le Bon Boucher, is that right?
That's right.
All right, that's French Bakery in Creve Coeur. Oh, I might go there just for the bakery. That sounds good. That's coming up tomorrow at 1:30. Then on Wednesday, Dr. Smith will be at the Hampton Inn in Wentzville at 6:30. And on Thursday, you'll find Dr. Smith at the Holiday Inn in Fairview Heights. That also starts at 6:30. Dr. Smith provides, listen to this now, more of these ProSomnus sleep appliances than any dentist in the United States. And that's why I say success means you sleeping, and sleeping comfortably, and that's why she has such success. Right now she's offering $1,000 off the cost of a sleep appliance through the end of May. Call today to make an appointment for a consultation with Dr. Smith. Dentistry with TLC is located in beautiful Godfrey, Illinois. To set up a consultation, call 618-466-0733.